Good afternoon, everyone. This is Rhonda at Ideal Body Image, Ideal Weight Loss in Georgetown. Today we're doing we affectionately call it a vajayjay treatment with the Kutera Juliet. I'm here taking my handpiece out. This is a treatment that we actually use internally and externally, both. This is the handpiece. There's a little wand on it that is the dial. Right at the top is the laser. If you can see that, it's going to spin all the way around 360 in the vaginal canal. And I use these markers. I'm going to put it in as far as it can go. And then we're going to gradually come out a centimeter at a time. And as I come out, I'm going to do 360. We do a cool pass, and then we do a warm pass. And what that's doing is it's really rejuvenating the lining of the vaginal canal. It's really good. Any woman who's, had a baby, if you're struggling with urinary incontinence, urgency, even people who've needed like bladder slings, this is an alternative to getting a bladder sling procedure done. So there's a lot of really good benefits. Also with this, there's another handpiece that I'll put on that is going to resurface and kind of plump up the outer labia area of the vagina as well, which is another added bonus because we lose fat through the years as we get older. And so this helps collagen and elastin regrowth and, stimulates that. So all in all, it's a very quick treatment. Prior to this, I've already numbed the patient outside. There's no need to numb inside. I'm also I just need to make sure I dry your area. Relax.
What is the recovery process like?
Honestly, the recovery is not much of anything. You feel a little spicy the day of the treatment. Okay, relax real quick. There you go. Very good. You okay? Good? Great. We encourage people, no intercourse. The paper says 72 hours. We tell people 2 weeks. Listen to your body. You are going to know as a woman whether or not you feel up for that. There sometimes is some mild discharge. Very rarely is there bleeding, but every once in a while a little bit. Most of it is odorless and colorless discharge that goes on. So we're going to go ahead and start. 3, 2, 1. And so you can hear the little thumping noise. And so everyone's cervix are different depths. Again, that's where it's really nice. The gauge, the speculum that I showed you has markers on it. And so I'm able to see that I'm, at a 12 with this client. And so I'm going to just come and spin it all the way around. Each of those thumps, if you hear it, that's the laser firing. And so we're going all the way around, getting 360 coverage so that we're really resurfacing the lining of the uterine walls. So again, what happens is through the years, right, we get built up and it's almost a resurfacing, if you will. And what we find is that people get tightening. So there are some intercourse benefits to this often. Most of my women, though, do this for urinary incontinence. Maybe when they jump rope, they might leak on themselves, or when they sneeze. If you're having urinary incontinence issues, we absolutely recommend 3 treatments. Usually spaced 4 to 6 weeks apart is you're going to get your best benefits from. So how are you doing from a pain? Good. So really you'll find the patient is relatively comfortable. I find the warm treatment sometimes, I don't know if intense is the right word, but my core temperature heated up when I did the warm pass. Where the Cool Pass is really, it's just a thumping. It is an interesting sensation though, because your bladder is on one end of this and your rectum is on the other. So sometimes it's as though you're almost like an urgency to urinate, and then the other almost feels like maybe I have gas. And so, but again, also with many of my women, if they've had a birth vaginally, they're very tolerable of this procedure. And again, if anyone who's had a child is a good candidate for this procedure, because they're going to just get overall tightening and collagen, rebuild. And so that's going to really help. And then again, it's also strengthening those muscles inside and helping tighten so that you can hold your, urine a little better, and so that the urgency improves. Thank you everyone for visiting. Now when we finish with this, I'm going to use that other hand piece and do an outer surfacing as well. And so again, dark labias, things of that nature, we see really good results lightening that. Thanks for visiting.